Good afternoon, everyone, and thank you so much for joining us today. I think we're going to go ahead and start right on time. Mr. Canales, if you're ready to go, we'll go ahead and get started.
I am ready. Thank you very much,
Fantastic.
Emma.
Thank you. Well, as Mr. Canales said, my name is Emma Merlo. I am going to help you facilitate this webinar today, and I want to thank you all for joining us for this HFT and CHFT credential launch webinar this afternoon. Our presenter today is Mr. Mike Canales, the Owensboro Community and Technical College HFL Program Director, and we have a pretty great presentation put together for you all today. Just a few things to go over before we get started. All participants are muted, and that's to respect the audio quality of the recording of this webinar. If you have any questions during the course of the webinar, please post them in the chat box, and at the end of the webinar, we'll circle back in and we'll review all those questions. So I'm going to post a chat in that box right now, just so you can see an example of what that looks like. All right, well, that's all I have to take care of. I'm going to go ahead and hand it off to Mr. Canales. We're ready to get started whenever you are.
I am ready. Thank you so much. And I want to thank everybody for being part of this webinar, the first webinar of two. The second one will be a similar, if not the same webinar, February 14th, for those that were unable to attend today. I'm excited about this. This has been a 3-year journey towards having this conversation about a healthcare facilities technician. When the program started here for healthcare facilities leadership about 5 years ago, it was pretty quickly after that, within a year or two, students in the program and people around the country were talking about the need to develop technicians, maintenance workers, if you will, and how difficult it was finding folks who had qualified the qualifications. And it was becoming increasingly difficult to find trades folks, as we're all starting to experience these days. So I went around the college and I asked some questions about, the trades programs here and their interest in healthcare facilities. And there's two things that I found out that really surprised me. The first thing is nearly all the trades folks here, when they asked me the question, how much would a entry-level graduate of an HVAC program or a electrical program get coming into our profession? Based on this region, I said, somewhere between probably, around 30, 35,000, maybe 40 on the very high end in this region. And they looked at me and they sort of laughed. They said, well, you won't even get my worst technicians because my average technicians are getting, 60, 70,000 a year. And my best technicians or electrical HVAC folks are getting, closer to 6 figures. And the second thing that I found that was interesting was almost all the vocational programs, including plumbing and welding and HVAC and automotive, were delivering, because of the industry, associate level credentials along with technical credentials. And that was another surprise. And when I reflected on our profession, our industry, and the complexity of our industry, both those things really caught my attention. And so I started the journey of figuring out how can we create a foundation for and a recruitment and a development for our profession. And that's come to this conversation today. The first thing I want to do is I want to review the objectives today. We're going to review the need very quickly, the credentialing precedent. We're going to review some survey results from ASHE 2017 from employers, the benefits, proposed benefits of the program, how the program is proposed to be delivered, and then we're going to do a demonstration. I'm excited about remote competency demonstration, and then do Q&A. It should take us about 35 minutes, maybe to 40 minutes to get through this section, leaving 20 minutes or so for questions. I want to do an OCT fact sheet here. It really seems like it's been, I don't know, maybe not as long or longer than this, but the program was established January 2014. It's the first nationwide program for developing leadership, supervision, and management built around the CHFM. It's 100% online courses. I still get asked that a lot. Is it 100% online? And it is. Self-proctored no-cost readiness test. This is a big deal because we were the first in the nation to trial a no-proctored readiness test for English reading and math for college entrants a couple years ago. And it's now starting to roll out across the system and nationally. And it was because of the HFL program and students all over the country that were remote and couldn't get to a testing center, or it was too expensive, or coordinating it with full-time work schedules was too hard. And this is a big deal for us and for the country. We accept previous college credits. Again, as I mentioned before, it's built around the CHFM 4 pillars of PDC, codes, maintenance and operations, and management. We've now enrolled students from 38 states, just enrolled someone from New Jersey this semester. We do give experiential credits. This is primarily for management. I have folks in the program that sometimes have upwards of 25, 30 years of management experience. And so we have a way to give credit for management experience. The CHFM step test is for those that have the CHFM. They can take a step test that may get them out of 3 classes. Interestingly enough, I've only had one person step test out of all 3, but almost everyone always steps tests out of 2 classes. And after they take it, they admit that that one class they didn't step test out of was the area that they were weakest in. The free application process, low tuition, no out-of-state rate, keeps the cost down. I'll mention again, that the cost here in this region keeps the cost in at a low enough level that tuition reimbursement by most employers ends up covering the full program. Faculty and instructors are healthcare facility professionals and experts. I'm proud to say that 90% of the students and graduates enter our profession, and the few that don't either leave the profession or for some other reason they'll have life circumstance changes where they don't go into our profession, but the vast majority enter our profession. And I'm also extremely excited about the fact that every person that's received an HFL credential and then taken the CHFM has passed it the first time. So all this in just a matter of 5 years, and we're just going into our 6th year. I love this saying. I have several throughout the presentation that sort of bring it home for us. And this is from Mickey Mantle. It's unbelievable how much you don't know about the game you've been playing all your life. And I know for those of you who've been in healthcare facilities for a while, every time you peel back something and you learn something else, you realize more and more how much you really just don't know that you don't know. And I think that's the amazing thing of the job. It's the challenge that we love about it, but it's also sometimes what keeps us up at night. And being the consummate professional, I think, is really critical in this industry. We have a looming crisis, and it's actually already here. It's not just the 10,000 people retiring every day. It's also that vocational workers will probably retire earlier. It's hard work. They've worked in the trades for a long time, and they're not going to be like administrative management folks who might work longer. Think about it, folks. As soon as they get to that 62 and get benefits, and again, if their stock market, if their 401ks look good and the retirement benefits look good, we might lose them sooner than we think at a greater rate. And also, as of September, our unemployment rate in this country is at a 50-year low. So we have a crisis that's here when it comes to find talent and qualified personnel. Also, the industry is growing. Our industry is growing. This is traditional facility management is expected to grow at 12%. That's not healthcare facilities management. That's just traditional. And also, we have obviously a greatly aging workforce. And I would say that when it comes to facility management, most folks enter this industry later in life. And so they're not in it for very long. And so they leave pretty quick. And at the same time, the expectation for growth in labor for electricians, plumbers, and HVAC is considered highly accelerated for the next, this is from 2016 to 2026. So you can see what's going on here. And at the exact same time, we're starting to see some things that are happening in our industry that we never used to think about, particularly in the outpatient environment as it's expanding. Infection control risk assessment, pre-construction risk assessments, above ceiling or overhead permitting, ASHRAE 170 with air ventilation issues, and ASHRAE 188 waterborne pathogens, the extension of HIPAA and HCAPS, disaster planning, which expanded in 2017 to all 17 healthcare types, obviously environmental rounds and active shooter. I put a note there. Does facility also fill security roles? And I know that it's true. Very often we are security in many small and even maybe medium facilities. So things that we never used to think about in these outpatient facilities are now applicable to all of them, continuing to create, I think, a crisis, if you will, for our profession. And then you think about the skill sets that our technicians need. People have asked me, is this why isn't this maintenance worker, or why is this maybe like maintenance, facilities engineer? And you think of the word technician, and you think of technology, and you think of basically technical skills, and that's really a big shift has been for a while now. We do need to have technicians. We need people who are engaged in technology. You look at all of our fire panels and our computerized maintenance management systems, nurse call, building automation systems, and so on and so forth. And there's no doubt we're immersed in technology. We have this reporting requirement now for infection control and pre-construction and end-of-life safety that requires us to be much more detailed and aware of code and compliance. Our technicians need to be able to speak to a wide audience, from the patients, from infant all the way up to older folks, to folks that can hear or can't see, to doctors and nurses and administrators. I mean, they're literally are walking hospital attendants or little supervisors all over the hospital talking to folks. The ability to write, articulate codes and standards, compliance, customer service, critical thinking, and then you get down to those unique elements to healthcare: medical gas and life safety, emergency management, ventilation, the electrical systems, and even energy management is unique in healthcare. So we expect our technicians to know more and be engaged more in things that maybe 20 years ago they were not that engaged in. Another issue that has been surfaced over the last, I'd say 5 years particularly, is CMMS does an annual report based around disparity rates. In other words, when they validate our surveys and they look at where the issues are, what they have found is, if you look at the top 5 standard areas, and these are them in front of you, that the physical environment is by far the biggest, the most cited area during validation surveys. And it's interesting because infection control is right behind it. And that's been sort of an emerging, standard element in the last 10 years. And we play a big part there too. So when you look at those two elements together and you get about 33% of the disparity rate falls in those areas, this is why there has been such an increased focus on compliance and regulation and accreditation when it comes to the environment of care or the physical environment. And so if you go into that report and you break it down a little bit further and you look at the physical environment, these are the top 10 areas: means of egress, fire sprinklers, smoke barriers, hazardous areas, doors, keep going, electrical, fire alarm, generator, HVAC, fire extinguishers. These top 10 make up 90% of validation survey findings. And this is what we're feeling in our industry right now. This is why we have the ILSM that now changed to shift +1 with Joint Commission, or within 24 hours by policy. This is why they're asking us to inventory all of our life safety elements. This is why they're asking for 100% compliance on preventive maintenance. They're trying to basically, they're telling us, we see that you are an issue. We want you to fix it. So they're pretty much bearing down on us. And if you want to look at that report, they put it out there about a year and a half later after the year. The new report's about to come out for 2017. Take a look at that report, and then you'll find out why they're bringing down pressure on us, and probably even what they're about to do next. And then, of course, see it, cite it. Years ago, we used to be able to take care of things during the tour with the life safety specialist. Now, you can't. Everything that they see, they cite. Now, they risk assess it, but what happens is that list of minor things, including the major things, go to your administration now. And your leadership is now accountable for this. And that's just been a change within the last couple of years. Not only that, but the serious findings in the physical environment have increased from 5 to 15 on average. So because they're seeing it and citing it, they're finding frequency and issues more and more. And all this boils up to, our area is under an area of focus, but what's the solution? What's the problem? How can we try to start to fix this issue? And can we acknowledge we do have a problem? And again, this is what I've been studying, and this is what I've been working on. And in my opinion, there are solutions here, but it's going to take a lot of us working together. In fact, this is a phrase I've used often. If in the past, if personnel knew what you knew, they might take your job. Today, if personnel don't know a lot of what you know, you could lose your job. The reality is, there was a time when folks came to that person in that office, director or manager, and they were the ones that had the books and the codes and the answers. At least that was the perception. And that's never really was true even then. And today, it's definitely not true. We need to have a technical expert and content experts all over the organization. And everybody that works in healthcare facilities, in my opinion, needs to have content, technical expertise in their areas. And that brings us to the academic credential precedent. It's probably obvious to many of you, but maybe not to some, that all around us in healthcare are people who get academic education, and then they get a certification, and then they have to maintain that professional certification. Obviously, we're very familiar with the CHFM. However, if you look in the hospital, you see radiology, lab, surgical techs, pharmacy techs, sterilization techs, medical nursing assistants, and now there's a new position called an MNA, which is kind of a hybrid of a nurse's aide and a data entry person with a phlebotomist for these outpatient facilities that have to get an academic credential with clinicals and labs and a certification, and then maintain a certification. And that list down below that is a list of all of the traditional professions we see in healthcare and their numbers that have to have academic and then clinical certifications that they maintain. Imagine that 3 million nurses, and you go down the list. So we have a precedent around us with people who deal in very complex jobs, the people who deal with fairly, if you will, narrow jobs where there's this precedent. And I know most of you, if you were to sit there and think about the complexity of healthcare facilities, would admit that we're probably somewhere up this list when it comes to complexity. But why is it we don't have a professional development pathway? And that's sort of the question I've asked, and I think that we need one, and that thus the presentation. But I think that the mandate, when I say that we're a precedent, there's a lot of precedent around us. Should we have that same precedent is the question. Here's some justifications for it. I mentioned a few a moment ago. It is increasingly becoming more and more complex. It takes too long. A lot of folks come to our profession sometimes after they've had a whole nother career. They're 40 or 50 years old. They've been doing something else. They come to us, and now they're with us for 10 or 15 or 20 years, and it's hard for them to step out of their previous role and become competent in facilities. We need professional development throughout a career. I don't know that anyone can walk into a healthcare facilities job, no matter what experience you had before, and then not have to grow and learn more. In fact, I've asked many people, how much did you know when you came in and how much did you need to learn? And most people will say they knew very little to none, to maybe 10%, and they need to learn 80 or 90% after they got into the profession. We're very clinically involved between infection control, between ventilation, between ligature, between medical gas systems and waterborne pathogen issues. And now there's conversation about indoor hydration. So we're very clinically involved with what happens with the patient and how that patient, whether they heal or whether they become more compromised. Again, there's precedents all around us. We need to break down our trade silos. I've said it, and I've talked to my peers around the country, and we laugh and agree that a lot of folks will come in and say, hey, I'm an electrician, I'm an HVAC, I'm a carpenter, I'm a plumber. And they really sort of point to each other and say, that's not my job. And rarely do they embrace the healthcare facilities like life safety, or maybe even dealing with ventilation issues when it comes to ceiling tiles and things like that. They don't see that as being their job. They see it as being someone else's job. And often they see those things being the manager's job. Well, the reality is we need to break those silos down. It really is the majority's job. We have this expanding outpatient footprint with regulatory requirements, which we talked about. Excuse me. We also need to recruit earlier for aptitude. We need to grow our own. It's hard for someone to come in, a young person to come in and be growing in our industry. When I talk to folks around the industry, most folks will tell me, no, we need somebody who has 20 or 30 years experience in something. And they very rarely want to take the risk on a young person coming in. It's been more and more my opinion that if we can find people with aptitude, that's really what's important. And then give them a foundation. We can teach them the skills, in my opinion. We still do need those seasoned folks. I don't disagree, but I think we need to start bringing some younger people earlier. I mentioned earlier about think about the technician or the HVAC person graduating a program that's going to get paid $70,000 a year. They're not going to come to us. We can't compete with that. And so what's going to need to happen is we do need to bring people in at, $20,000, $25,000, maybe $30,000 a year, and then grow them over years. We got to give them a pathway, and they will come because we're a great industry. Again, decades of the same accreditation issues. I don't know that we've ever gotten away from the issues in accreditation that are on that top 10 list. We've gotten some new ones, but by and large, they've been there as long as I've been in the profession, and that's over 30 years now. National standardization of foundational knowledge. It's another benefit of credentialing. And again, the competency language and requirements by the accreditation organization, CMS, are coming down on us where we are required to have different increasing levels of competency. Many of you who will look at those codes and those standards and those regulations realize they're expecting us that our people are trained and that they're competent with everything that they touch. So all of these things, I think, support a credentialing mandate for the profession. What's the benefits? Well, the benefits, I think, are multiple, including improved regulatory awareness and response, improved accreditation, improved infection prevention awareness, response, and engagement. Better succession planning and a career pathway, increased use of technology because we bring it in the younger generation, more comprehensive healthcare facilities awareness as folks are just walking down the hallway. They're seeing the building differently. And again, a more qualified hiring pool. So, when someone comes to you from another state or another region or another hospital, you know what their foundation is. You kind of know, you have a sense of what they know. Standardized foundational knowledge, again, kind of go along the same way. And I mentioned before, the opportunity for rural facilities to start growing their own. Think of the challenge that a rural facility has in trying to find a qualified person. And then many times what you see around the country is we recruit people from other regions into a region. And I think most of you would agree, lots of times when you recruit somebody from, 500 miles away or 300 miles away, the likelihood that they're going to stay and stick there goes down, I think. It works out a high percentage of the time, but lots of times they don't. They go back to where they came from, or they just not committed to that locale or that region. I know of a facility right now that's been looking for somebody. They're pretty rural. It's in the mountains, and they've been looking for a year. And they've had to actually, good or bad, they've actually had to increase their, it's a manager's position, but they've had to increase the salary for that one little facility to a lot higher than the other 5 little facilities they have, because nobody wants to move to that part of the country for some reason. So we get challenges. We need to grow our own. Now let's make a little bit of a turn here to a survey that I did back in 2017 in Indianapolis. 22 folks representing companies, representing about 1,500 technicians, filled out a survey on this program. And when I got the survey back, I really thought, okay, we're going to go. And I'll come back to that in a minute. But this was the results of that survey. 100% indicated that they're going to have a shortage in the next 2 to 4 years. So they're in the middle of it now. They represented about 1,500 technicians. They anticipated needing 300 to 500 in the next 1 to 3 years. 20 out of the 22 would encourage technicians to enroll in a program like this HFT, as I explained it then. And 14 indicated they would be willing to pilot the program, and 11 said they would incentivize the credential. And the average pay level, entry level, was $25,000 to $30,000. 1 indicated there was no need for the certificate, and 2 indicated that the HFT would not provide an advantage. I mean, to be fair, so not everybody was on board. In fact, the folks that said that they didn't think they needed it, they were the ones looking for more seasoned trade type folks. So laid out the need, laid out the issue, laid out, seems like there's a desire for it. How are we going to deliver this? Well, this is the thought. I want to do something, and I've been thinking about this for a while now, and I've gone through the college, and it's something that can be done. And it's actually quite much newer than you might think it is. And that is, it's combining the worlds together. The first part is, we're going to still keep this online. We're going to do what I call the didactic head knowledge, online. There's 2 courses we already have in place: Introduction to Healthcare Facilities Management and Infection Prevention and Control for the Environment of Care. These classes have been very successful, especially infection prevention. I get more positive feedback from this HFL 120, and I have more students who go through it to say every single person in healthcare should take this course. It gives you a really comprehensive and fairly deep look at how involved facilities management is in infection prevention. And I really feel like this program is saving lives. But these programs, which are already there, are part of the HFL program. Students would take these online. They would also take a healthcare facilities orientation program that would give them a comprehensive overlook of healthcare facilities. And here's the real interesting part. Lab 1 and Lab 2, and these are just placeholders, is that I would deliver and give, the program would deliver and give competencies built around life safety and medical gas. We'll look at these in a minute. Healthcare ventilation, electrical. Give those to the healthcare facilities. You're already required to do competencies anyway. These are code-driven competencies that will lay the foundation on the 4 pillars that are unique to nearly every healthcare facility, every healthcare building. And what happens is, as you check people off, you're not only demonstrating competency internally and to the accreditors, you are demonstrating competency for the program. And once these are filled out and given back to me, there'd be a college lab credit up to 4 credit hours for each of these that's not paid for. It's experiential. And then I would take and do capstone courses for each of these labs that validate that knowledge. This is where folks would get into the books, they will write, they'll take quizzes. Again, it'll sort of like burn it in. It's said that when people go to webinars, even like this one, or presentations, that folks probably only remember about 20% of what they hear. However, when they actually sit there and read the book themselves, and they do it didactically, if you will, the knowledge retained goes way up. What I love about this idea particularly is this is for people working in the industry. So they're just not going into a program and reading a book and then getting hired. they're doing this while they're working in the industry. So they're working with your culture. They're in your culture. They're with your equipment. They're understanding your healthcare facility, and they're applying knowledge that a lot of experts have come together and said, you know what, this is foundational that every technician should know. So it's really exciting, the idea that we can actually do kind of a work, earn, and learn program, and very few, if any, other professions are doing it this way right now. And I can't really think of any that's looking to do this in this way. Also, by it being here, like I said, it'll keep the costs down. And there's 18 total credit hours to this credential. 10 of them would be paid, and 8 would be no charge. At today's tuition cost, it's less than $2,000. It would take about 1 to 2 years for folks to go through this program. And what I have found is that most tuition reimbursement programs at most facilities, if they have it, is between $2,000 and $3,000. So if you think about this, spreading this out like about $1,000 to $1,500 a year, the tuition essentially could be covered by your own tuition reimbursement program with no out-of-pocket costs, except maybe for books. So there's a lot of opportunity here. I think the price point is right. And I wanted to get now into the details. Oh, let me back up just a second. So this is sort of the career ladder that looking to put into place. And you notice that the Safe Day 1, which is the healthcare orientation program, which is actually more than that. That would be one part of the healthcare facility orientation credit. The HFT certificate, which I really thought I was going to launch last year, but I found out I needed to go through a big education process, not just for the college, but for the industry. And this is the culmination of this education process, where I've been talking to people around the country now for about 1.5 years about this. And again, there's a real big misunderstanding about what this was. And I think more people understand what it is today. And I'm going to answer some questions too about some confusion about this program in a minute. There is also a CHFT proposed. I think that is very important to marry with this academic credential so people continue to grow throughout their profession. My goal is to really, many hands, if you will, can lift heavy loads. And we really need more people engaged. So CHFT is what keeps people engaged. It keeps continuing education. I think it's going to be great for ASHE nationally. I think it's going to be great for the chapters around the country. I think it's going to absolutely be great for the healthcare institutions, that when you have technicians that are continually crafting and growing in their profession. And I really do believe an associate's in HFT is down the road, because just like the other industries I mentioned earlier, there is this precedent where they want people to have speaking and writing and broader skills in other industries. And I think our industry needs them as well. If you think about it, there's 5,200 hospitals approximately around the country, spread all over the place. The ideal is, how do you reach people in the most rural places? How do you reach people in around the country like this, who are working and busy and full-time or part-time in these healthcare institutions? And I think that because of technology, we have a tremendous opportunity to do this more efficiently than anyone's done it before. That's probably the good thing about waiting, if you will, 50 or 60 years to start creating an academic credential for our profession. We now have a lot of technology that did not exist 20 years ago. So the ideal is work and learn. Use 5,000 plus hospitals as lab, make it competency-based, make it code-driven, make it comprehensive on those 4 pillars. And use the online medium, if you will, as the guild. I've collected so many great experts around me as instructors on my advisory board, and people that I've worked with over the last 5 or 6 years. I mean, just the network of folks around the country. In fact, I'm excited that 16 ASHE chapters that I've been to many of these chapters speaking, have sent this this webinar to their members. And that network of people and companies, as I'm hearing this from all kinds of companies, the idea that we need to develop this. And as I sent out the competencies, they came back pretty much universally with like, yes, these are good, these are solid. I had very few, if anyone, come back and say, no, they don't make any sense. And I want to jump into that right now. I want to show you these competency checklists real quick. And this is the latest version. They're going to be drafted and improved a little bit better from this. But these lists, which are built around these 4 pillars, if you look at them, you got the top, which is the typical stuff, the facility name. We got the manager and director that says, yes, I'm going to do this at my facility. You got kind of a start date and a completion date. And I'm not sure if we really want to or need to do this, but I'm thinking having a pre-test score and a post-test score would be a great idea. And the reason why is because I just think that, when you see how far you've come, it's something you can be proud of, and you can actually see people grow. And then you have these individual competencies, which are driven right out of code. and you can see the V in the middle. You see the competency with the code. Now, here's the thing that you don't see, and actually still really is in development. And I'm going to show you a sample of how it's going to be developed in a minute. Under every one of these competencies is going to be more detail for the preceptor. It's going to give the scope and the depth of the competency. So we go the right level, and we don't go too deep, we don't go too shallow. It's actually not going to give you the answers per se, because we don't want to necessarily make this something where you can pretty much just give them the answers and they can just answer them like that. You want them to dive into the books and into the different places and learn it for themselves, and then come back to you and be able to verbalize it. That's the goal. So you got these verbal competencies, you got some demonstrated competencies like testing of egress lights, testing of exit signs, means of egress, illumination is a verbal. We go down to the next page and there's more competencies, and they get a little deeper sometimes. If you look at, I've been asked several times from some people, you know, what is this medical gas? Let me see, which one is it? Understanding of CGA pin index systems and CGA diameter index safety systems. One of the fascinating things that I found out when I was going through these codes is that some of these say that technicians shall know something. And this is one of those ones you can look it up. It says, anyone that handles cylinders shall know this. And I had never saw it before. I never really read it before myself. When I read that, I said, wow, I don't know how many people I know even know what this is. And I had to look it up, and it's not that hard, but it's very important. So there are things in code that says shall that we need to be able to verbalize, and pretty much every technician needs to be able to do. Now you go a little deeper on these competency lists, and you can see as far as code references go, I point to CMS adopted codes, and then I point to a lot of codes that are pretty much based upon whether your authority or what your building or what your locale has adopted, to give flexibility for different places around the country. Now I want to go to the other competency list here, and that's the ventilation electrical real quick. It's the same thing, except it's code specific to ventilation and code specific to electrical. And you can go down there, and again, you can see the list. And I hope you're thinking of some questions to ask about this, because I'm more than happy to answer them. One thing that I did do is you look at the very bottom here and you say as required, transfer switches, as required, generator testing requirements in terms of demonstrated, maybe verbalized but not demonstrated. There are some small facilities where every technician really does need to know who's on call, how to do this. But there are larger facilities where your frontline maintenance technicians might never even get close to touching transfer switches or generators. So it gives you that flexibility that, you know, some facilities may want this to be a requirement of most, if many, of their technicians. And some facilities may say, no, you know, our folks don't need to know this. And that's okay. That's fine. I can understand that. Okay. Now, I'm going to get back to the presentation real quick, and this is where we're going to get to the live demo. I want to set this live demo up real quick for you. And I've been studying and reading about different companies, and one of the companies I've read about is a company called Alibaba. And Alibaba, if you don't know who they are, they're like the Amazon of China. And one of the things that Jack Ma, the founder of Alibaba, said that really caught it was a salient thought that he said, I'm not fishing for whales, I'm fishing for shrimp. And what he meant by that was, if I can make technology work for that person who works in the rice paddies, and he's afraid of technology, but yet I can make him comfortable with it, I can make it work for anybody. And that really was the goal of this demo I'm about to give. If we can make this work for the most remote facility, for the most remote technician that's growing somebody, you know, right out of a VOTEC program or out of a high school with aptitude at their facility, then we can make it work for everybody. And so that's what this demo is going to demonstrate. We only need a good cell signal. Now, we do need good preceptors. I can't stress enough that precepting is a trade, it's a skill, it's a profession. You know, doing meaningful, good precepting is very important. And of course, there's many other uses. I want to thank the folks that helped me with this. Mark Waller at Aegis, who's from Fireberry Consultants, who's sponsoring this webinar, who's also helped me with this demonstration. I'm Scott Blankenship, a good friend of mine, a New River Valley Hospital director out there in Christiansburg for Carillion Health System, who's letting us use his facility. And my son, Keith Canales, I call him Son Extraordinaire, who I've been dragging around for almost 30 years, making him do things that he's been so good about it. So we're going to do this demonstration, and I want to show you how this really works when it comes to how easy this could be for you. So the first thing we're going to do is I'm going to bring over and I'm going to open up a Skype window. So here's Skype, okay? And there's a call. We're making a call. And all I'm doing is I'm calling Keith, and he's going to pick up that line. And here we go. This is my son, Keith. Hi, Keith. And what we're going to do is we're going to do a verbal and we're going to do a demonstrated competency right now using Skype. This is how easy it can be. So again, once again, I want to thank Mark Waller with Aegis, Fire Barrier Management Consultants. And there's Mark. Say hey, Mark. And what we're going to do is we're going to do this competency, and we're going to start right now with a verbal competency. And Keith is also going to be using a jig from Aegis. He's going to show that jig. And I don't know if Scott's in the room, but anyway, I want to thank Scott as well. All
He's
right.
not here right now.
No problem. So here we go. So here we go with the verbal. Keith, what I want to do is I want you to describe to me the vertical design of a 2-hour firewall.
So 2-hour firewall must go from the floor to the deck.
Excellent. Describe the horizontal design of a 2-hour firewall.
Horizontally, it must be from exterior to exterior.
Very good. Now explain the minimum requirements of a door that goes through a 2-hour firewall.
So a door in a 2-hour firewall must be rated for a minimum of 90 minutes or an hour and a half.
Okay, very good. And explain the required rating of a light or transom that's in a 2-hour wall.
For light or transom, the rating is also 2 hours.
Okay, very good. What is the drywall construction of a 2-hour firewall?
Double layer, 5/8 inch thick on both sides.
Okay, very good. Here's my last question about 2-hour wall. I want you to describe the construction types and the importance of a 2-hour firewall separation. So tell me a little bit about what are construction types, and tell me what's the importance of understanding how construction types relate to a 2-hour firewall.
Yeah, so there are many different construction types, from wood, concrete, steel, speckled, non-speckled, and the different construction types can be rated for different types of occupancy. A 2-hour firewall allows for a fire to be on one side for up to 2 hours while emergency responders take care of it without affecting healthcare occupants on the other side.
Very good. And that's really what it comes down to. You could have a daycare, you could have an office, you could have a house, resident on the other side of that wall, some kind of assembly. But yet we got to protect the folks on this side, which are the healthcare occupants who are most vulnerable. Very good. Okay, we're going to switch to a partial competency now when it comes to like a door inspection. And we're not going to do the whole door inspection, but I just want to show you how well this can work. And mind you, we're not using the best phone technology or the best lens technology right now. There is better phone and lens technology that I've researched that'll work much better with wider angle and with more clarity. But even with this basic phone, this is how well this can work. So first thing we're going to do is we're going to do a door undercut. Demonstrate door undercut inspection, Keith.
Okay. Excuse any interruptions. We're in a working room, so the elevator might kick on.
Okay.
So first, we're going to use the Aegis jig to inspect the door undercut. And the door must be no greater than 3/4 of an inch.
All right.
From the floor.
So
Okay.
demonstrate
Get down here. And we're going to check the undercut, and this is greater than 3/4 of an inch.
All right,
That's a failure on the bottom undercut.
Okay, well, it failed. But show me the gap. Can you do the gap demonstration for the frame to the door?
We'll do that. We're going to start on the latch side, and for the metal door, it needs to be 1/8 of an inch plus or minus 1/16. So we'll start down here, and that passes at 3/16 on the jig. We'll come up here to the middle and check another spot. Also passes.
All right.
And we'll check up here at the top. We're also good there. We're going to continue along the top and check 2 different places to make sure that it's in spec. We're good here. And we're going to check over here in the corner. That also passes. And just continuing down the side to the top of the hinge side is good. We're checking the middle of the hinge side. Good.
Awesome.
And then lastly, down here at the bottom. Good.
Okay, well, very good. I want you to do a door swing.
Okay.
Check for me for the door closer.
What we're going to do is open the door, check the close. We're going to take this out to 90 degrees and let it swing close and listen for the latch. Okay, and pull on it and check.
Can you look down, please, so I can see? There you go.
There you go.
Excellent. All right, very good. I can see it. Good.
Flash.
Okay, one last thing. We need to do inspections of frame labels.
All right, so we're going
And
to
door
check
labels.
the frame labels, make sure they are present, and they are. We got one on the frame and one here on the door. Check the rating to make sure that it is adequate for the spec, and these are both at 1.5 hours, so they're good. And they're also clear of obstruction, perfectly legible, not painted over. So these are passed.
Excellent. You did a great job, Keith. I really appreciate that.
Great.
And I want to make a point here, and one more thing. The door failed. So because the door failed, Keith, what's the issue we have now?
Well, let me step out here. Get the elevator running. So we're going to be initiating an ILSM per our work order system to address that, and also starting a call to our fire authority per our work order system to get this correct, make sure we get this properly corrected.
And that's because you're not able to take care of that today within shift plus one or 24 hours by policy?
Correct.
Okay, very good. And I want to make mention that the door was intentionally taken out of compliance for the purpose of this demonstration. This is by no means a reflection of Carillion Health, Scott Blankenship's operations at his organization. They do a wonderful, wonderful job. Thank you, Keith. Thanks again, Scott Blankenship. And thanks again, Mark Waller in Aegis Health. Awesome. All right, that's it. So that demo right there, hold on a second. I got to pull this back up. Did I lose? Presentation coming back to you in just a second here from the current slide. Okay, so that's our presentation, and here's the timeline. So that's it. That's the big concept. That's the big idea. You know, the goal is, if you think this is the right time, that we need to get 50 applicants going here by the end of May. My goal is to have the official competency support that supports these competencies, that gives guidance to the preceptors by July, have the pretest ready by July. Obviously, students can enroll in the orientation 100, 120 class beginning in August. And then in January 2020, we would start having enrollment in those lab competency validation courses. And then the goal is to have by next June, to have a CHFT to match this credential. And that brings us to questions and answers. I'm running about maybe about 3 minutes longer than I thought. So we're at the end of the presentation. I do want to start you off with a couple of questions that you may ask, and I've been asked. What if there are not enough applicants? Well, we're going to hold up and update current applicants for the following semester. We'll just keep doing this every semester. Now we'll try this again maybe later in the year if we don't get them by this fall for January, and then do it again for next year. We'll continue to educate the profession and organizations on the credential, because I think this is a big lift to let folks know what's going on. Why 50 applicants? Well, did the numbers and crunched it. To get an instructor for the program, we need 50 applicants, and I need a part-time person to help with the enrollment specialist for the HFL HFT program. Adult learners come with a lot of special needs, and we need to embrace those folks, what I call concierge service, because they want to go to school, they're nervous about going to school, but they really need our help. And I'm not saying they're high maintenance by any means. I'm just saying they need to be made as easy as possible so they can continue to do what they have to do at work and home. We also need time to recruit for fall 2019 and get a program coordinator involved in the curriculum development. I'd love to have somebody who's actually working alongside me developing this, so they're here at the grassroots. And the last question I'm going to so I'm going to have some other questions I'm sure in a moment, is what is the difference between an HFT certificate and existing certificates? I am answering this question a lot. When it comes to academic credentials, they're very different than professional development credentials. The HFT is going to be an accredited didactic credit hour and college course credential, and they support and they lead to traditional professional development certificates. You know, the same as the majority of other healthcare workers. If you think about a nurse or a pharmacist or a radiologist or physical, whatever it is, they get this academic, and then it leads to that professional development. And in a nutshell, the OCTC HFL is not competing with current professional development efforts as much. It will be a feeder for many and future PD training courses. I think the reason why people are confused about this is because the idea of using the hospitals and using competencies to develop an academic lab is what's causing this to be maybe confused. But it's very different. Keep in mind, more advanced academic credentials like diplomas and degrees, they would require me to get people placement tests with English, reading, and math. And I don't want to do that. I want to avoid that because we want to make entrance easy. And in academia, a certificate allows you to do a concentration for the profession without doing those other college placement issues. So it allows me to get more people into the program than I would be able to otherwise. Because I'm almost sure that if I did an English, reading, and math placement testing, it would start blocking out many technicians. So those are 3 questions that get you warmed up. And now I'm going to go back to Emma and see if any questions were asked by others through the presentation. And if you have questions, feel free to ask them now even. Emma?
Thanks so much, Mr. Canales. So if you have any questions, please go ahead and post those in the chat box. We have a few that came in, which we'll go ahead and address now, and then we'll give everybody some more time to process and think of their questions. So one question we had was, would the certificate program qualify for federal financial aid?
Absolutely. We are a SACS accredited college, and certainly they would. And in the future, I can foresee them transferring if we can get other programs around the country rolling once we get this thing rolling.
Another question, which I can go ahead and address, people were asking if we are sending out the slideshow or a link to this presentation after the webinar. We will not be sending out for this webinar, but we will be presenting this information again during that February webinar. So you are welcome to register for that if you want to share it with any of your folks internally, have them register for it. It's on the exact same link where you registered for this webinar.
Yeah, and I'll add to that a little bit, folks. This webinar and this presentation is a cobble of probably 9 different presentations that I deliver on this and other related subjects. So I do, if you want, and you want to get up with me and you think this would be valuable for your organization or for your chapter or for your conference, give me a call. I would love to deliver this presentation or a tailored presentation for your organization so that we can, get the word out. It really helps. I love that feedback. I love that engagement out in the industry and being with my peers. I see myself as your peer.
Fantastic. Awesome. Thanks so much. And as y'all can see on the screen, you see Mr. Canales' email address. Is that the best way to connect with you?
Absolutely. Yep.
Fantastic. So we'll hold for a couple more minutes for people to type. Looks like we got another. Mike, will you be presenting at VSHE in May?
Yes, as a matter of fact, I am. Well, I don't know the Vichy folks. I think I submitted a proposal to Virginia and Roanoke, and I think I'm going to be presenting in May in Virginia. And maybe you might want to ask your leadership there to consider having me present there in May. But I have submitted a proposal for Virginia. Yes. Yes.
Great. We'll hold just a little while longer to allow people to type up their questions in the chat box. If you're not seeing a chat box on your screen, you'll need to hover your mouse over either the bottom or the top of the webinar software, and you should see the chat button where you can open that up. It looks like a little cartoon speech bubble.
Okay, and just by way of a little filler, what folks might be asking questions, I do want to let you know that our journey towards academic credentials is a unique journey. A lot of industries, a lot of the college itself, even other colleges don't necessarily see us as being any different than traditional facility management or traditional project management. As I have conversations, they really do look at me like we already do that. And when I tell them that, no, we're very unique, I find that it's a very difficult conversation because they really don't have a frame of reference for us. So it really is my goal that that's why I'm doing it this way. I'm not reaching out for money to any organizations to do this. I'm not reaching out to the college to give me money to do this. Even if they had it, I don't think if I could get it. But my point is this, is that I feel like our profession can do this. I feel like we have the need. I feel like, the cost is low enough. And I feel like that we can show the industry, we can basically show the college, hey, we support this and we can do this. And that's kind of my goal, not to chase grants, not to chase money from companies, but for us to do that lift together.
Great. And we have a few more questions that have come in. So will this program be up and running by at least 2020? What's your goal date for that?
No, the goal is if I get those 50 applicants within the next 4 months, this program will be running August. The goal is to have people enrolled. Most students, the vast majority will take at most 2 classes a semester, and many will take 1. So I can see students taking a year to 2 years to get through this. So it will be up and running. And the reason I say that is because no one's going to be ready to take those lab competencies until probably next January anyway. But I will have it ready for January if we get those applicants now in the next 4 months.
Great. Next question. Where can we get a hold of the Aegis fire door gauge? Are these for sale?
You know, I know Aegis does have them. Yeah, absolutely. They have those gauges. And as a matter of fact, we will send out Mark Waller and Aegis consultant barrier management contact information to the webinar folks. Can we do that?
We absolutely can take care of that. I'll make a note of that now.
Yep.
Next question. Will you be giving advice for grants to apply for?
Absolutely. As a matter of fact, I want to give a shout out to California and the Robert Mack Scholarship. That many of our students have received that scholarship. I also know that there are plenty of chapters that are giving scholarships. I had a conversation yesterday with a chapter that is seeking to generate $1,000 scholarships for members. And I would encourage you, if you're on a chapter, I think that's a great way to get folks involved. You know, use that money for professional development and offer scholarships for my program and other programs, if you will. But yeah, there are definitely scholarships out there. There's traditional financial aid. And like I said, there's always the opportunity for, I think for most people, employee tuition reimbursement. And who knows, maybe ASHE will generate some scholarships as well for the program.
Great. Next question. Are courses billed all at once or as they are completed?
Repeat that question.
So sorry, are the courses billed all at once or billed as they are completed?
Oh, it's like traditional college. You pay for it as you go. And typically we do have a payment plan at the college where you can make payment 2 or 3 or 4 payments over a semester. But typically you pay, you know, when you enter and you start classes. Mm-hmm.
Fantastic. Thanks so much. And it looks like we have not necessarily a traditional question, but some feedback for you, Mike, from your colleague at OCTC, Venus Allen, saying, thank you for presenting such a valuable webinar. We're happy to see you do it and enjoyed the presentation.
Awesome. Thanks, Vina. Well, is that it?
That's all we've got. We'll go ahead and hold for just one more moment, see if we have any follow-up questions to any of your answers. Give everybody a chance to type them out.
Sure. I appreciate the questions. And again, if you don't think of your question now, or if you haven't figured out how to use the technology to ask the question, really do feel free to grab that email and email me your questions. More than happy to answer them. I just finished talking to a gentleman today. I won't say the state, but his administrator asked me specifically what would be the benefit of this program to the work of the employees at their organization. And they have basically 400 technicians. And it was such an easy answer to answer. I feel like the engagement that you're going to get, the ability to retain, engage, and develop people, and for them to have awareness as they go down the hallway, I think is going to be like never before. And I gave him that answer on one of the slides, and he already came back and said he thought that was perfect. And I really do believe it's going to make a big difference.
Great. Well, we have 2 more questions. How does HFT compare with apprenticeship programs leading to licensing?
Actually, great question. I actually looked at developing the apprenticeship program at the same time. Actually, there may still be an apprenticeship program in the works. More specifically, I look at a 2-tier apprenticeship. In fact, this HFT program, I've already run through it, would qualify as an apprenticeship. Think of it as, again, a level 1, level 2. This is really that first 2 years of foundation for a healthcare facilities technician. The number of hours it would take to get through the competencies and the courses would qualify. There is still an opportunity to generate a national apprenticeship with this. I backed away just for a second to see if the credential will launch, and we may still do that. I see a second level apprenticeship that happens after this. So once they finish this apprenticeship, if we were to move that direction and get the HFT credential and apprenticeship, then you have people who are now exposed, especially the people we recruit, who are exposed to all the disciplines of healthcare. They now see electrical and HVAC and life safety and plumbing and carpentry and construction and all these other opportunities within healthcare. Then they go back to a second level of apprenticeship, if you will, to get a deeper understanding in electrical or plumbing or HVAC. So that is a great question. I've vetted it out. I've looked at it. Just being one person right now, I'm going to put that on the side burner for a moment. But if you see value in an apprenticeship, please let me know, because there is an opportunity to turn this into an apprenticeship program.
Great. Will you be sharing a link to enroll in this course?
Well, the OCTC website, we can certainly send that out. But I'd like to, candidly at this point, I don't think I could do it for as many people as we might bring in, but I love interviewing folks as they come in. I love filling out applications with them and getting to know them. The goal is to have that enrollment concierge do that with them, because as easy as the application may seem, there's like 5 or 6 questions that's just like our industry. Academia has its own language. And if you don't say things or answer things just the right way, it just slows everything down. So it is my goal to really, help people into the application process. And yes, I can give we have an online application that you can do. But if you're really interested, let us send you an application and let us fill that application out with you and make sure we get you started the right way. So you can use my email address, basically. All right.
Is there executive or high-level program information that can be provided to C-suite teams to gauge interest?
Repeat the question, please.
Is there executive or high-level program information that can be provided to C-suite teams to gauge interest?
Yes, I do. I can get that information together for you. Yes, I put together either a slide or put together a short presentation or a couple of short slides. Mm-hmm.
Great, and it looks like we have some more feedback, and we'll probably choose to wrap up on that feedback. If y'all have any further questions, of course, Mr. Canales has offered to allow you to get in contact directly with him. You're also welcome to reach out to Casey, and we can connect you with him. So last piece, Gulf Coast Regional Medical Center thinks you put on a great demonstration from Panama City, Florida.
Awesome. Thanks a lot. That demonstration, I was nervous about that. we had to use multiple layers of technology. Actually, what we did, it was a lot more complex what we did through Zoom and through the webinar versus how easy it is using Skype. It is so easy. I checked GoPro, I checked all these technologies to do this and found out, hey, Skype, cell phone, perfect. Works really well. And there's a couple of phones out there that give you 160, 140 degree view, which will make that competency even better. So we're just at the beginning, folks. I'm excited about what we're able to do these days.
Fantastic. Looks like one last question come in, and we'll ask this one and then we'll cut it off. Do you have an estimate of the cost per credit for this program?
Yeah, the cost right now, because we have a $20 online fee, is $197 per credit hour. Again, the HFT credential will be 10 credit hours, so basically just under $2,000 for earning that credential.
Great. Well, let's go ahead and wrap up there for the day. I want to thank everyone for joining us today, as well as Mr. Canales for presenting, as well as Keith Canales and Mark Waller for helping us with that on-site demonstration. Really fantastic presentation. Thank you so much.
All right. Thanks, everybody. Have a great day, and I really appreciate it.
You too. Thanks.
Take care, Mike.
All right. Thanks, Mark.